In my talk, I cover two broad areas. One called the inherited bone marrow failure syndromes, and secondly, familial myelodysplasia and leukemia. In both of these groups of disorders, they're quite heterogeneous, but they're associated with the predisposition to malignancy, particularly leukemia. So they are, there are many, over 100 genes that are linked with these disorders. So they are disorders that present with a wide range of clinical problems, ranging from aplastic anemia to somatic abnormalities to upfront myelodysplasia or leukemia. Well, one of the things is it's important to, because they're actually quite rare, some of them are at an incidence of about 1 in 1,000 to 1 in a million. It does mean that you, as a clinician, have to be aware of their occurrence in order to make the diagnosis. So making the correct diagnosis is very important, because it's sometimes easy to think that they are a representation of some of the common diseases like myelodysplasia, leukemia, but they have an underlying genetic basis. So making the diagnosis is very important. Then in terms of the treatment, that will in part be dictated by what the underlying diagnosis is. So as I said, there are 100 different disease genes that can give rise to these different disorders. So for example, if there's a particular group that my group has an interest in, that's the disc keratosis congenita and the telomere diseases. There are about 20 genes that now are responsible for these disorders. Once you make a diagnosis of disc keratosis congenita or a telomeropathy, you have to then keep that in mind when they get a cytopenia or leukemia, because when you give them drugs, you have to use lower doses of drugs. And if you're using a donor from the same family, for example, you have to make sure that the other family members are not asymptomatic carriers of that particular trait. So there are peculiar or unique aspects to managing these inherited bone marrow failure, leukemia predisposition syndromes compared to the standard idiopathic myelodysplasia or leukemia. Okay, so that's broadly what I would say. And then as you home in onto particular categories, there'll be additional details that you will need to take on board in terms of managing them.